Welcome back to Iron Strengthens Iron, where we bring you medical and psychological insights rooted in faith and wellness. I'm Dr. Kevin T. Hattaway, a family physician, and I'm joined by my brother, Dr. Michael E. Hattaway, a clinical psychologist. Today we're diving into a topic that hasn't gotten the proper attention it deserves and has been somewhat commercialized, often at the expense of a real understanding of men's health.
That's right, Kevin. Today we're discussing part 3 of our series on low testosterone, or low T, which has serious implications for men's health. Let's shed some light on this important topic and explore low T's physical and emotional impacts. Let's continue with understanding the stigma surrounding low T.
In our experience, low testosterone often comes with a stigma. Many men view it as a loss of manhood or as if they're failing somehow. And to make matters worse, it's been heavily monetized by pharmaceutical companies, who've turned it into a quick-fix product without much focus on educating men about the real health implications.
Exactly. This stigma can prevent men from seeking the help they need. But the truth is, starting as early as our 30s, testosterone levels begin to drop naturally. It's not a moral failure or something you're doing wrong. It's simply biology.
Right. While this decline is natural, lifestyle factors like diet, medical conditions, and stress can speed up the process, making it a more serious issue if left unchecked.
So, Kevin, let's discuss the medical aspects of low T. I'll add some mental health insights along the way. What is the role of testosterone in men's health?
Absolutely. Testosterone plays a critical role in men's health. Produced mainly by the Leydig cells in the testicles, testosterone could be seen as the captain of the ship, responsible for defining male characteristics, like muscle mass, energy, mood, and overall physical vitality.
And when testosterone levels fall below the norm for a man's age, it can lead to symptoms that are often misinterpreted. Men might be seen as lazy or unmotivated when the real issue is hormonal.
That's a great point. So what exactly qualifies as low testosterone? Generally, a total testosterone level below 300 nanograms per deciliter is considered low, though there is some variability in these standards. Let's talk about recognizing the symptoms of low testosterone.
So, what symptoms should men watch out for?
The symptoms often start subtly and go unnoticed for years. Common early signs include mood changes, irritability, difficulty concentrating, and a drop in motivation or performance at work and in physical activities.
Low T can also show up as irritability, mood swings, and even full-blown depression. This can create emotional and relational strain, which often goes unexplored because people don't connect these issues to testosterone levels.
Exactly. Men may also notice fatigue, reduced stamina, and weight gain, sometimes despite diet and exercise. Over time, untreated low testosterone can lead to conditions like obesity, insulin resistance, and eventually metabolic syndrome, prediabetes, and type 2 diabetes.
These symptoms, especially in the early stages, are easy to dismiss as burnout or simply aging. By the time men seek help, usually for issues like low libido or erectile dysfunction, years of mental and physical health damage may have already taken place. Okay, let's explore the long-term health risks of low testosterone.
That's right, Michael. Left untreated, low T increases the risk of many health issues, including diabetes, obesity, hypertension, high cholesterol, sleep apnea, osteoporosis, and even mental health conditions.
Absolutely. Low T has a profound impact on mental health, including mood changes, depression, and suicide. Low testosterone levels decrease a man's resilience to stress and make it more difficult to cope with life's challenges, big or small.
It also affects physical health by reducing muscle mass and increasing abdominal or visceral fat, which elevates cardiovascular risks such as heart attacks and strokes.
And as testosterone levels decline, stress management also takes a hit. Testosterone is like a natural buffer against stress, so when it's low, men struggle more with stress resilience.
That's because low testosterone is closely linked to cortisol, the stress hormone. When cortisol is high, it directly opposes testosterone. Chronically high cortisol levels can lead to insulin resistance, depression, and a condition called non-alcoholic fatty liver disease, which may progress to cirrhosis if left untreated.
Here's the good news. Low testosterone is treatable. Kevin, let's talk about some of the benefits men can expect from treatment.
Absolutely. Treating low testosterone can reverse many symptoms. Studies show that it can improve insulin resistance, reduce body fat, increase lean muscle mass, and enhance libido and energy levels.
It can also increase resilience to stress, boost mood, improve work and sports performance, and improve overall mental health.
Right. Men often experience improved cognition, memory, verbal fluency, and relief from depressive symptoms.
So, let's talk about treatment options. What do men need to know about boosting their testosterone levels?
Natural supplements such as maca root, fenugreek, boron, ginger, ashwagandha, and other supplements such as vitamin D, magnesium, zinc, ginseng, and DHEA are known to increase testosterone levels.
And for men with levels below 300 nanograms per deciliter, prescription strength hormone replacement therapy is often recommended, right?
Yes, prescription testosterone replacement therapy is typically administered as an injection or gel. This approach is monitored by a healthcare provider to ensure safe and effective results.
Who should get tested for low T, Kevin?
Any man over 40 who's overweight or anyone experiencing irritability, low stress tolerance, or fatigue should consider getting his total and free testosterone levels checked. I also recommend that men with type 2 diabetes have their testosterone levels checked.
That makes sense. If you're experiencing any of the subtle symptoms we mentioned, testing your testosterone can help you catch low T early and avoid further damage. Key takeaways and next steps.
To recap, the subtle signs of low testosterone can include fatigue, poor stamina, mood changes, irritability, weight changes, and decreased motivation and focus. If these sound familiar, talk to your healthcare provider about testing.
This is crucial information, and I'm glad we had the chance to explore it. Our next episode, Part 4, will focus on mental resilience and emotional well-being, exploring ways men can build mental strength and resilience to better navigate life's challenges with grace.
Thanks for tuning in, everyone. Remember, you don't have to navigate this alone. We're here with you on the Iron Strengthens Iron podcast. As we close, here's a verse that really speaks to resilience and strength. Isaiah 40, verse 29 to 31 says, "He gives strength to the weary and increases the power of the weak. Youths grow tired and weary, and young men stumble and fall, but those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint."
This is a beautiful reminder that no matter what we face, we're not in it alone. When we're feeling weak, we can draw strength from God and continue pressing forward with hope and resilience.
Before we go, remember that today's content is for educational purposes only and not a substitute for professional medical advice. If you're experiencing symptoms, reach out to a healthcare provider to explore your options.
With that, we'll see you next time on Iron Strengthens Iron. Take care, stay strong, and keep strengthening one another. Until next time, keep striving, stay faithful, and remember, as iron strengthens iron, one man strengthens another.